Welcome back to The Blend. Today we have a bonus episode with Dr. Stephen Daveluy, Professor of Dermatology and Residency Program Director at Wayne State University School of Medicine in Detroit, Michigan, where he shares which gender identity, pronouns, and sexual orientation information should be included on intake forms.
Welcome back, listeners. We have Dr. Steve Daveluy with us today, and after recording a few episodes, I could not just let him go. So we have a special hot take segment for you today where I want to ask him one important question. So Steve, should every dermatology intake form include gender identity, pronouns, and sexual orientation information, or can that sometimes create more barriers than benefits as we work towards making an intake form? Please give us your hot take.
I do believe every intake form should collect that information. I think it's helpful for us in the future to do epidemiological studies. If we have this information, we can do it. If we don't, we can't. It also makes patients feel included. You know, when you see an intake form and it doesn't have one of the options that fits your identity, you feel a little alienated and maybe like this clinic isn't the right place for me. I will say it can create some problems. I do feel that the benefits outweigh the problems. But sometimes if you get patients who have strong opinions and political opinions about the LGBT community and what should be collected, they may sort of complain to the staff that, you know, I don't think these questions are appropriate or something like that. And in that case, the staff can always say, well, you're welcome to skip any questions on the intake form that you're not comfortable asking. We're just being inclusive. And it depends a little bit where you practice. Giving these talks across the country, some people have brought up that in their area, the political climate is not very LGBT friendly, and they were really nervous about making an inclusive environment because they were afraid of the backlash from patients who don't support the LGBT rights. And I said, the intake form is a simple way. And then if you want to put up the signs to make people feel welcome, sometimes you can find logos that the LGBT community members will recognize as a welcoming sign, but people who aren't in the community may not, sort of like a covert way, like the pink triangle is a classic one that's sort of a low-key sign that is friendly to the LGBT environment, but people outside of the community may not even recognize that that's what it means. Wow. So you can kind of covertly let people know that they're welcome without getting as much backlash. But sometimes it's still good to put the signs up and just take the backlash because you're doing the right thing for patients and being inclusive.
I support that. I would do the second one. And I can relate to that in a way where, you know, having certain conditions that I have, and when I'm filling out an intake form and my condition's not on there, and it's actually a pretty common problem, I don't feel included. I feel like, oh, wow, this person I'm about to see or this people around here, they don't know that my problem exists or it is important. So it is that, I think that's a very common issue and mindset with lots of other things, but it is extremely, extremely valuable here. Well, thank you so much again for being here and sharing your hot take on this topic.
Absolutely. My pleasure. Thanks for having me.
We hope you enjoyed this bonus episode of The Blend. We'll catch you back next time.